From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. This episode of Care Experts is brought to you in partnership with Sono Bello, America's #1 cosmetic surgery specialist. Body confidence means something different to everyone, and so does the path to achieving it. Liposuction is one of the most well-known aesthetic procedures out there, and for many, it can be a powerful next step in their confidence journey. Today, we're joined by Dr. Christopher Chung, a medical expert at Sono Bello and a leader in aesthetic treatments like TriSculpt Micro-Laser Liposuction. Dr. Chung is here to help us separate fact from fiction and help you feel even better in your body. Let's get into it. Hello, everyone, and welcome to the Care Experts podcast. I am sitting here today with Dr. Christopher Chung, who is here to talk to us all about liposuction. Welcome to the Care Experts podcast.
Thank you. Thank you. I'm glad to be here.
I thought we could start off today by busting some liposuction myths. Are you ready?
Yes, there are a lot of them out there.
Let's dive in. What are the most common myths or misconceptions about liposuction?
Well, I think the most common thing that I hear is it's a weight loss procedure. And we know that I can see why that would be construed as so.
Yes.
When in fact, liposuction is really about size reduction. It's about making you smaller. It's about making you more proportionate. It's not really about weight loss. Of course, there is some weight loss associated because fat has some weight, but it's really not about weight loss. It's really about making you smaller and making you more proportional.
Interesting. What about the idea that results are instant or that the fat will never come back again?
So there's some truth to that because the difference between liposuction and dieting is that when you're doing liposuction, you're actually removing the number of fat cells. As opposed to when you're dieting, you're simply reducing the size of fat cells, but the number remains fairly constant.
Okay.
And so they're really addressing different things. One's about reducing the number of fat cells, and one's about reducing the size of fat cells. So from that standpoint, once the fat cells are removed, they're permanently gone. So in that sense, the results are permanent. Now, in terms of immediacy, yes, patients get very excited. The very next day, they remove their garments and they say, wow, look at me. I'm so much smaller. I'm very happy. But then the ugly swelling catches up. And day 2, day 3, and it increases. And then they start to get worried. What happened? What's happening in my body? I'm actually bigger than I was before the surgery. But rest assured, that is your normal body's recovery process. And after a while, all that swelling subsides. And what you visualized on day 1 comes back.
Okay, I feel like that's so important for people to know as they're going into this, that at first you may notice that your size changes and then things will subside and land where they're supposed to land after that.
Absolutely.
Is it important for someone to hit a certain goal weight or size before doing the procedure, or can you do liposuction at any time?
Well, I think any time may be a bit of a stretch, but I will tell you that traditionally people have always said liposuction should be done at or near your ideal body weight. That is a very traditional thinking. That's something that has been sort of professed for many, many decades.
Yeah.
And at Sono Bello, we sort of challenged that notion. We challenged it about 16 years ago, and people said, you guys are crazy. That's not the way it should be done. Well, fast forward, 15, 16 years later, nearly 400,000 patients, we feel very validated in treating much wider range of patients. Because a lot of patients are really not looking at liposuction as the solution.
Right.
They're sort of looking at it as a jump start to sort of get them on the right track. And so I think if applied appropriately, liposuction can in fact be very useful for a wide range of patients and not simply patients at or near their ideal body weight.
That's so interesting. I feel that if somebody was at their ideal body weight, then they probably wouldn't be considering liposuction.
Well,
So why would you ideally want to be at your ideal weight before doing it?
Well, so there's a notion that one thing I forgot to mention was is not only at your ideal body weight, but for those problematic areas, for those trouble spots that
Right.
no matter what you do, whether you're at your ideal body weight or even below, just genetically, there are some fat deposits that are very stubborn and resistant. And so I think technically, and way at the beginning, in terms of our conceptual thinking, liposuction should be applied for those focal areas. And now we know that liposuction can be applied to a much wider canvas and help people with a much wider range of base.
I see. What are the most common benefits people see from liposuction?
I think there's really three main benefits, and the first two has to do with the body, and the third, which I consider to be the most important. I think, first of all, you should not get liposuction unless you're going to see a reduction in size. I mean, let's face it, liposuction you do to remove fat. When you remove fat, you should see a smaller self.
Right.
If I can't ensure a patient that you will be smaller, I won't offer liposuction to the patient because there's no anatomic benefit.
Right.
Then there are patients where they feel very disproportionate. Like they have a hard time fitting into certain types of clothing because perhaps they feel like their arms are too big, or they feel like inhibited from wearing certain types of clothing, or maybe from the outer thigh region or the saddlebags. So liposuction can be applied to those target regions to make your body far more contoured and proportionate. But really, I think what I've appreciated in the course of being with Sono Bello for nearly 10 years is that those are bodily changes, but the ultimate benefit is about how person feel about themselves. It's about the empowerment, it's about the confidence, because everyone, we live in a very hectic world, and this whole world is about you giving, and this is really a means to sort of bring something back to yourself a little bit. And I think it's great to always be shopping for someone else, but there are times when you should also sort of shop for yourself as well.
I have interviewed hundreds of women over the years, so I know deeply how insecurity or a lack of confidence in one's body image can impact every other area of your life. I think that sometimes there's a stigma around treatments like this, if we're being honest. And yet you would see in clinics and in practice that it can be really life-changing for somebody.
Oh, it's immensely gratifying, because through the body, their whole world changes. How they deal with their professional work, their personal work, how they deal with their significant others, how they feel about themselves. It really does. It's really about confidence boosting. It's about empowerment. And that's really the ultimate benefit.
I think in an ideal world, it would be amazing if everyone felt confident in themselves and beautiful 100% of the time. But as you said, we do live in a very busy world. Our outside appearance does impact various different things. And so if this is something that is going to make somebody feel good, confident, more capable of going out into the world to and form relationships or get a job, then who's to say that it shouldn't be an option?
Absolutely. Absolutely.
How does modern liposuction, especially something like TriSculpt, compare to older methods that were used?
So we live in a world of technology. There's no way that we can not talk about how technology impacts every industry, and cosmetic surgery being no different. And so it's really about what can technology do that the traditional medicine couldn't do. So if you talk about traditional medicine, and especially when it comes to liposuction, it's really about having a vacuum and having a tube and having some means to suck the fat out. That was it.
Right.
Now we have laser. At Sono Bello, we apply, laser assisted. And so what does the laser do? Laser helps tighten the skin. It helps to emulsify or melt the fat. And therefore, we can use far smaller cannulas to achieve the same outcome, but much safer and with a much shorter recovery. And so that's really the difference between traditional liposuction and what we do at Sono Bello, which is TriSculpt, which is to apply the modern technology to make it safe, to make it effective, and essentially sort of fit the modern world a bit better.
What is one thing you wish more people knew before considering liposuction?
There's a lot of, I wouldn't say it's one thing, but we live in an information age where information is free. You and I can get online and immediately we'll have million results popping back at us. The unfortunate thing is, I think we can all agree, not everything is true. There's a lot of great information, but there's also a lot of bad information. And so we encourage our patients to be educated. And that's really what this whole process is about. Gather all the information, read all you want, look and view all the YouTube videos. But to sort of make that final decision, all we ask is come in, we're sort of the experts in this field. Listen to what we have to say and let us tailor and sort of distill all that information into fact and fiction and apply it to you. And because everyone's different, what's right for you may be very different than someone else. And that's all we're asking of our patients, is to come in and find some facts.
Yes. If somebody is considering liposuction or wondering if it's right for them, where would you even begin in determining if they're a candidate?
Yeah. So, they come in and a lot of patients sort of have a sense of what they want. Now, whether what they want matches with what they can have safely and effectively, I think that's sort of the bridge that needs to be made. So, no one, let's face it, this is aesthetic medicine. So to say that someone needs cosmetic surgery, I think is far-fetched. It's an individual decision. So I think patients come in with the desire. And really our job is to sort of see if there's an appropriate treatment plan to match that desire. And sometimes the answer is no. And we have to have that difficult conversation and say, we don't believe anything that we have to offer is right for you. But it's really that whole process. I think it's a journey and it's a partnership and relationship with the trusted provider, so that, my main job is to be your advocate and tell you what I feel is in your best interest. And sometimes that is telling you things that you may not want to hear.
Right. I love that you said that this is not a need, but a want or a desire. And a want or a desire is still a valid reason to do something. When you think that when you have to have that conversation with someone where you're like, I don't know if this is the right fit for you, what would generally be coming up in that circumstance?
So, when I think that sort of dives into what we call candidacy, are you a good candidate for this? And there's really three things that I like to focus on in candidacy. One is the medical candidacy, because first and foremost, we want to make sure that this is a safe procedure for you. We know that all surgeries have risk, but we can definitely make it safer. And so a big part of that consultation process is going through the medical history and making sure that this is safe as possible. If, in fact, we determine that this is not a safe procedure for you, or if the risk is too high, then we would counsel the patient as such.
Right.
They would also have to have an anatomic benefit. I'll be extreme. If you have no fat, what's liposuction going to help you with? You have no fat to remove. So once again, we have to make sure that you would get the anatomic benefit from this procedure. And I think the third part is probably the most important part. It's an informed consent process.
Right.
Meaning you have to understand what you are about to go through, both in terms of the risk, potential complications, the benefits, the alternatives. And that's really the understanding, because if you don't understand what you're going to subject your body to, then you shouldn't have the procedure. If I feel like my patients don't understand, then it's not the right time. Then we need to spend more time educating and getting to know each other.
And is that something that would be occurring in that initial consultation or visit that you're having with a patient, where you're talking them through all of those details and making sure that they are a good candidate?
Yes, we certainly start that journey. It's a lot of information. And one thing I've realized in being a plastic surgeon for over 20 years is I think I've said it. I think I've said it 3 times. And yet somehow the patient didn't hear it. And it's no fault to the patient. It's just a lot of information. for anyone to process. So you have to sort of layer in that information through multiple segments and multiple contact points. And then that's really what we try to do. We try to sort of layer in that information and then always go back and say, hey, can we touch on that again? Just to make sure. And I always encourage my patients to write down every question, because sometimes you go home and you think about a question and you say, oh, I forgot to ask that.
Yes.
Well, write it down, because the only thing that I have to make sure is that before we actually enter the operating room, all of your questions are answered and you are 100% completely satisfied to the degree possible that this is, in fact, the right decision for yourself.
I love that. Now, if somebody has decided that they're going to move forward with having a liposuction surgery, what does that procedure actually look like?
Oh, yes, yes. So a lot of people already tell me, oh, I know what it's about. I saw it on YouTube.
Right.
Yes and no. So on the day of the surgery, you come in and it's a very busy day, right? Because we have to get you ready for surgery. And so our nursing team is involved with doing all the things to sort of get you ready. But in terms of the actual surgery itself, there's really sort of like 3 parts to the surgery. So before we even enter, we give you some medication to sort of calm your nerves and make you feel better. Then once we're in the OR, the very first part about the surgery is about getting you numb. Anesthesia. And I think that's one of the big advantages that we have at Sono Bello, is that we do this awake with some oral sedation, minimal sedation. So you're very comfortable, you're not nervous, but you're still awake, and that makes it very safe. So first and foremost is making sure that you're numb. Then we apply the actual liposuction part. That's when patients get excited, because they see the fat going through the tube. They see this yellow fat and they see the canisters filling up.
Wow.
And they're like awake and they're like, yeah, fill that baby up.
Wait, is there a sheet or something, or they're just watching all of this
Well,
happen?
we do have sterile sheets, but we keep their head open.
Yes.
So they're conversing with us, and we encourage them, hey, do you want to see your fat? And some people say, oh, no, I don't want to see it. Other people say, yeah.
Yes.
And they are constantly looking at it, and they get very excited about it. And they're like, I can't believe this. I'm talking to you, and I'm seeing my fat being sucked out.
Right.
But that is the second part. And the third part is the laser part. That's the technology. Because what does the laser do? It helps tighten the skin. Because one thing that liposuction does not do, it doesn't really impact the skin in terms of tightening and addressing the looseness of the skin. And that's where the laser technology comes in to help tighten that process. And that's a 3-part process to the actual surgery itself.
That third part, using the laser, is that happening at the same time when somebody's on the table, you've removed the fat, and then you're using the laser right then and there?
Yeah, so we use a different device, a laser device. And, patients typically know when that part's coming because they get to wear these fancy goggles for eye protection. And they hear a little zapping noise and whatnot. But by that point, patients are like, I felt nothing, is that it? And it really is just nothing to the perception of the patient. But in terms of its impact and outcome, it does wonders for skin tightening.
Wow. Now, I'm so curious, do you ever do an additional surgery at the same time? Like if somebody's coming in for a mommy makeover or maybe having, some liposuction on their stomach, are you ever doing an additional treatment?
Oh, in fact, about 50% of our patients choose to have additional procedure done at the same time. At Sono Bello, we call that our ABX procedure. And that's in addition to everything that I just described about the removal of fat. Then once that part's done, then we remove the skin. And just like as if you're having a tummy tuck. And how much skin we remove really depends on the patient. Some people have a little bit of skin, other people have far more amount of skin. And so we really tailor that. But to answer your question, yes, about 50% of our patients choose to have additional skin removed on top of the liposuction to address their needs.
Okay. I'm curious, with the rise in GLP-1 use right now, where people are losing weight, are those individuals then sometimes coming in to do liposuction to reduce size a little bit more, or to focus in on one specific area? Are those things often used?
Oh,
hand in hand?
we're seeing a tremendous surge of new patients coming in
Yeah.
because GLP-1s, let's face it, they're amazing for weight loss, and people are losing a significant amount of weight.
Yeah.
I think one thing that people didn't consider was, yes, they're a lot smaller, but what about the skin?
Right.
The skin is still there. And for a lot of patients, it sort of inhibits them from fully enjoying the benefits of weight loss because every day they're reminded of what it used to be because of all that excess skin. And at Sono Bello, like I just said, we are able to address the skin removal. So if it's in the front, we do our procedure called ABX. And if it's along the sides or in the back, then we do a LiftEX, which is essentially doing a lower body lift in conjunction with addressing some of the problematic spots. And all that is done, believe it or not, awake.
Wow. I would think with the weight loss drugs that it would almost replace liposuction. But what I'm hearing from you is that oftentimes they can work well in conjunction with one another as a more holistic approach to helping somebody get to the space that they want to be in and to feel more confident and comfortable in their body.
It's a very complementary because, once again, weight loss drugs are about weight loss. We've already said liposuction is not a weight loss mechanism. And so we find sort of patients who are applying whether GLP-1 is done first. So if someone if their primary goal is to lose weight, then we encourage patients to go on GLP-1s or any other means to lose the weight first. And then if there's some problematic areas or if there's excess skin, then we can address it. We do have some patients who are saying, look, for me, it's not really about weight loss. It's about wanting to feel better about myself, just getting a jump start. There's some areas in my body that are just very resistant. So for them, it's about body contouring. And so they actually choose to have liposuction first. Now, here's the thing. Liposuction by itself has to be maintained. It's not the end-all, be-all in terms of after you have liposuction, you can eat whatever you want and lead an unhealthy lifestyle. It's a waste. It's a waste of investment that you made on yourself. So maintenance of proper, healthy lifestyle is extremely important, one of which is not to gain a significant amount of weight afterwards.
Right.
So some people actually use GLP-1s after liposuction as almost like a maintenance.
Right.
And to sort of really consolidate and stabilize the impact of what liposuction has been able to achieve for them.
That makes complete sense. That was going to be one of my next questions. We talked about the fact that this is permanent in that you are removing the fat cells, but as human beings, we can gain fat cells back. So let's talk a little bit about recovery and post-recovery, how we maintain those results. How long does the recovery process last?
So I think we have to be a little bit careful in talking about how we define recovery because everyone's different.
Right.
I have some professional athletes and their main concern is when can I go back into training, as opposed to someone working a desk job or someone doing manual labor.
Yes.
And so we are very careful to sort of say, let's define recovery. Yeah. But in general, I would say that the recovery can be sort of broken into different segments. There's the immediate post-operative period, and there's sort of the intermediate, and there's sort of the long post-op. Then there's this pain and discomfort. Fortunately, because of the way in which we apply liposuction and the numbing process, the pain is not a huge component to liposuction. Most patients are on narcotics for 1 or 2 days, but they quickly go over to over-the-counter medicine, whether it be Motrin, Tylenol, and we encourage that. We don't want you to be on, pain medicine longer than you need to be.
Yes.
And we do encourage lots of movement. Believe it or not, after surgery, it's very important for you to get up and move around. And that keeps your circulation going. It gets your lungs expanding, keeps the bad blood clots away. So ambulation and activity is great. Then we have to talk about the swelling. What I generally tell patients is that 6 weeks, 60% of the swelling is gone. So depending upon how you look at it, you could say, wow, that's good. That means that more than half of my swelling's gone.
Right.
Other people sort of look at it, wait, that means I still have 40% swelling left.
Yeah.
And yes, you do.
Yeah.
And not every day is going to be better than the day before. It's a lot of up and down.
Right.
And you have to be prepared for the fact that you're going to have some good days and you're going to have some bad days. But that is part of that process. Now, because we realize that that's when patients need us the most, we tend to keep in very close contact with our patients through emails, through text, through actual office visits, because that's a journey that patients need quite a bit of support in. And so we want to make sure that we support the patient's journey after the surgery, even more so than before.
You mentioned that you work with professional athletes, which my jaw dropped. I was like, what athletes are doing this? Are you seeing more men, younger individuals, athletes coming in for liposuction? And what are the trends in that area?
Oh, absolutely. Plastic surgery at one point, I think we can all agree, was sort of deemed for a very small selected group of our people. That's not the case anymore. Plastic surgery and cosmetic surgery has become very well integrated into the mainstream, as it should be. And so we are seeing a lot more. So what are we? A lot more men are getting cosmetic surgery done. It's not just for the woman. And men are saying, hey, what about us? We're still working. I want to sort of look more youthful. I have problematic areas. I don't like my chest. I don't like my love handles. And yes, those are great areas for men to get their liposuction. I think a lot of younger people are also getting it too, because that's being more proactive and preventative as opposed to being reactive. So they're trying to prevent things from happening.
Right.
And so I think there's a lot of sort of prejuvenation is what we sort of call that, as opposed to rejuvenation. So they're trying to sort of be more ahead of the curve and to make sure that they're not getting the sagginess, the wrinkles and whatnot. And so I think that's a very important trend that we've witnessed probably, I would say, within the last 5 years or so.
We have some incredible questions from our audience that I would love to ask you for our Ask Me Anything.
I hope they're not too hard.
You seem like an expert. I feel like you've got this.
Okay.
Probably nothing that you haven't heard at this point, I would say. All right, number one, I'm pretty happy with my weight and feel healthy overall, but there are a few areas I'd love to sculpt and tone better. Can you still do liposuction when you're not necessarily trying to lose weight?
That's what liposuction was first designed to do, was to target those problematic areas. And I once again emphasize liposuction is not a weight loss tool.
Okay. I've tried things like cool sculpting and laser treatments before on my stomach. They helped, but honestly, I want more noticeable results. Would I be a good candidate for liposuction?
A significant part of our patients have had and tried different modalities before. And while a lot of them are beneficial, the results are less drastic. And so patients are left with, I wish I could have gotten more. And so a lot of patients seek our services to sort of help finish that journey.
Okay. I've been wanting to get chin liposuction to help get rid of my double chin. How does that procedure work? And is the recovery different from body liposuction?
Well, I think liposuction is still liposuction. It's over a much smaller area. So we use smaller cannulas, but the exact same process of numbing, applying the laser, removing the fat still remains the same. There's more sculpting to the neck area. And so we apply a lot stricter sort of artistic sense to the neck. But in terms of the actual process, it's no different than, for example, doing your abdomen.
One last question for you.
Of course.
If you have somebody coming in who's struggled with their body image for a long time and they do the surgery, of course, that's going to support them in having a better body image. But are there any things that they could do after treatment to kind of further that, further building that confidence in themselves and avoiding falling into the pitfall of like needing more and more and more?
Yes. So we always partner with our patients, and we really do describe it as a partnership. It's a journey that we walk together, but I also hold my patients accountable. I'm like a tough grader, and I say, hey, I do my part, but you have to do yours. And so we lay out that journey with the patient and say, hey, don't think about the surgery as being the finish line. That's just the starting line for you. And we sort of lay out that timeline, and we give them realistic goals. And we say that, at 6 months, you should be here. At 1 year, you should be here. So much more of a long term. And yes, like true, it's hard. It's hard to sort of be disciplined enough to stay on course. But we do our best to sort of be there for the patient. We have long-term follow-ups. We encourage patients to sort of seek us and say, come back, even if it means just say hi. And we have tons of patients coming back and say, hey, I know I don't have a follow-up with you, but let me tell you how well I'm doing. And patients give us emails and they send us little notes. I still have patients texting me from 5-6 years ago and say, hey, I know, doc, you forgot about me, but I haven't forgot about our journey and my commitment to you. And I think it's building that relationship that really helps patients stay on course.
I love that. And I love the holistic approach that you take in your practice and at Sono Bello. Thank you so much for being here today.
Oh, my pleasure. Thank you.
Thanks again to Dr. Chung for joining us and for sharing his expert insights on liposuction. We appreciate it. And thanks to everyone for tuning in. This episode was brought to you in partnership with Sono Bello.
Through November 30th, 2025, earn an entry for a chance to win $5,000 in the CareCredit Let's Get Digital sweepstakes. Enter the secret word BODY in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States, D.C., and U.S. territories 18 years of age or older who have a CareCredit credit card as of 9/2/2025. Void where prohibited. Promotion starts 10/8/2025 and ends 11/30/2025. Grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.